bad call. And so we're empowering people to speak up. Mama, if you feel pain and the doctor says it's not real, go to somebody else. Don't just sit at home with that pain. Go get a second opinion, get a third opinion, even if you need to. Insist that you are seen. Recently, I shared a story of it's a famous person. I never heard of him until I saw his story. A famous, I think it's a dancer. He was diagnosed with colorectal cancer at the age of 21. And again, 21. And it all happened because he insisted that something was not right. They kept telling him, you're okay, you're only 21, so, you can't be this and you can't be that. But he insisted. And eventually, when he got tested, they found out that he had colorectal cancer. Lucky for him, it was caught early because colorectal cancer, again, is one of those cancers that is preventable with screening. When it's caught early, it's very treatable. So he's fine. But we need to trust our own bodies when something is wrong and then take action on that, not rely on somebody else to influence our decision making regarding what we know to be a fact that something is not right, which is one of the things that my mom, even I don't want to say I fault her, God bless her soul, but in all that time that she was feeling that fatigue, she was, completely weak, and she kept going to the hospital and they would send her back home with a drip. She would go to the hospital and they would send her back with a drip. If she had sought another opinion, even a third or fourth opinion, maybe things might have been different. But she trusted her physician. She had been with this doctor for a long time. He was supposed to be one of the best in town, but then this is what we're dealing with. So our education is widespread.
There's something they didn't see. There was an oversight somewhere.
I think that, yes, there definitely was an oversight, because at least with a cancer patient now, with this work that I do and in my own process of educating myself about cancer, and of course, as a professional in the health space, when a patient has recovered from cancer treatment, from then on, they remain within the system. They must be tested and screened frequently for certain things, and there's with some cancers, there's a particular schedule within which they must be scanned again, and the numbers and the labs are looked at, and all the markers are checked. And so an experienced oncologist might have been able to do that. But then back home, because oncologists are so few, in Cameroon, for example, with a population of like 25, 26 million people, I think we only have like 10 oncologists. So patients rely on the general practitioners for care, and they're not equipped. They do not have the bandwidth to be able to handle cancer patients. Once you've had cancer, you should be in the care of an oncologist, regardless. You don't have to have active cancer at that point, but you should definitely have a relationship with your oncologist that is for life.
That's true. Thank you. Thank you so much. Thank you, everybody who have shared their story. I hope everybody is getting blessed. Make sure you're liking the live stream, commenting, and sharing to everybody, because this information is very important. We are learning something. We are learning to do things like, if you feel you are not well, don't stick to one person. You can go to another, just in case if there was an oversight somewhere, you are able to get help earlier. Thank you so much. Sturgeon, what specific gap in cancer are you solving as a team, as a non-profitable organization?
First, I wanted to send hugs to Oshenik and thank her for sharing her story. It's not easy. Honestly, it's not easy. Cancer is so prevalent that stats are showing that eventually everybody is going to be touched by cancer one way or another. Either they're going to be the patient, or they're going to be a caretaker for a cancer patient, or they're going to know somebody who knows somebody who has cancer. It's that prevalent. But we work in low resource settings. low income country like Cameroon. And even here in the DC area, we work with our immigrant population and also the African American population. And so we fill the gaps wherever they exist. A lot of people deal with the lack of expertise. We do a lot of research and education to empower the community with information about what cancer is, what the risk factors are, what we can do to empower ourselves by changing, some of the bad habits that we know have been linked to cancer. But we need to remind people that there is no answer that fits it all, right? Because there are people who do everything supposedly right and they still have cancer. Like my mom, for example, she never smoked, she never drank, like hard alcohol. She would have wine with her food, but she walked every single day. She ate very, very healthy. Lemon. Everybody was saying lemon is a good antioxidant. My mom would sleep on lemon all day long. She did everything right. So we try to tell people, you cannot control everything, but those that you can control, please do. It can only help. It's not a guarantee, but at least it can only help. So we fill the gap of information. We fill the gap of the lack of expertise. We try to link people up with resources. For Cameroon, for example, we have cervical cancer screening activities that bring resources to communities that would normally not have them. In the remote villages, we have screened so far over 4,000, maybe close to 5,000 women for cervical cancer. Because like I stated before, that's one of the cancers that with screening can be detected early and prevented. When those changes just start to form, when you find them through a pap smear or other means that we use in the field, the women can be treated and they're done. The cancer is taken care of. And so we bring resources to communities that would normally not have them. We fund, for those that are in the bigger cities, for example, women or men would approach us who might have been told they need a biopsy, they cannot afford it. They need a scan, they cannot afford it. So we bridge the economic gap as well, the financial gap. We try to, support with funds for cancer diagnosis, and then also for treatment. When patients are diagnosed, cancer treatment is very cumbersome, very cumbersome. So we also try to support patients that are going through the cancer journey with payment for treatment. Support their families also, the caretakers. We are starting right now to form a support group because as we have seen during this live, talking about it, sharing about it, it really is, it relieves some of the mental anguish, some of the emotional pain that comes with it. It's part of the healing. And so we're starting to form a support group for that. We bridge the gap of trying to get the government to recognize that cancer treatment, cancer management, support of cancer patients is not something that should be left in the hands of advocates and community workers. This is something that government should be deliberate and intentional about. It should be a line item in the budget. I mean, we are pushing all of these ideas out, hoping that if policy can be put in place to mitigate some of these challenges, hopefully we can realize that the burden of cancer will start to reduce. What else do? We hold medical missions, for example. We organize medical missions where we bring in resources other than just cancer screening. Our medical missions are hospitals. We bring in a small hospital into a village and we provide services from blood pressure, diabetes management, through dental, ophthalmology, sleep apnea, physical therapy, pediatrics, pharmacy, surgery. I mean, the whole works. When we come into town, we bring a hospital to you. We're there with you for 5 days and we leave. And we've done that for the last 10 years. Last year made 10 years since we've been doing it. So we're doing our best. in our own small way to relieve the burden of disease in our communities. And I know it's not enough because in the communities we've been to, like I said, this is our 10th year. That lady, the mommy that we screened in 2013, for example, because we have not gone back there, our objective had been to spread the whatever resources we have through all of the different regions in Cameroon. And so because we have not gone back there, sometimes I wonder, because should we have now, after so many years, go back and reassess? And because again, cancer can come at any time. The fact that you screen today doesn't relieve you from the burden 2 or 3 years down the line. So it's a revolving issue, but we're doing our best to see what we can do as far as that as well. What else do we do? We hold conferences. We hold a cancer walk every year in 2 cities. We're on the radio. We're on social media. The reason I joined TikTok, I have been, I'm sorry, I shouldn't have said that right. I have been very active on other platforms. The foundation is very active on other platforms. And I was realizing that it's harder to form a community in those platforms than it is where we are now. And so one of my objectives was not only to bring the education to this platform, but also to try to see how maybe we can form a community that can work hand in hand, not to provide resources to somebody else, but to help ourselves stay current with our screening. We empower each other. I could call Dr. Mwenda and say, Dr. Mwenda, it's 2026. Have you done your screening this year? And if you haven't, how can I help you do that? What is the reason you have not done that? That is in the back of my mind, that's one of the things that I believe I can achieve with a TikTok community, with a community on this platform. Again, to empower each other, hold each other's hand along this journey, and so that we are talking the talk as far as helping ourselves while we're also helping others.
Thank you so much. I know that can happen. It can happen, but you really need to start going live, even if it's once per week. It's recommendable to go like 3 times, 30 minutes or 1 hour for people to know you and come in, and now you're able to create a community. We are here to support you. There's no worry if you're in a different community. We still come and support. And thank you for the good work you're doing. You're doing amazing. I know it's not easy because it's voluntary. It can be tiresome, but you're doing amazing. What I did not capture, you talked about the audience, yes, but what specific audience do you capture? Do you do here in America only? Do you go to Africa? Which audience do you?
We're active here in the Washington DC metro area, the DMV they call it, because that's where I'm located. But we have had patients who have reached out to us from other states here in the USA, and we have supported them. We turn nobody away. We might not be able to provide 100% support, but we do the best that we can for everybody that reaches out to us. And we also in Cameroon. We have been to Sierra Leone on medical missions, but mostly Cameroon is where we're at. We're open to going anywhere we're invited. But yeah, for now, we're in Cameroon. And we support in so many ways. Women have reached out to us just for wigs, for example. A woman who loses her hair to cancer treatment might need a wig, and they reach out to us and we'll provide them with a wig. We have a wig donation program. We have a breast prosthetics program for women who have lost their breast to cancer. So we do a little bit of everything so that we're providing holistic care and support to the patient and their family.
So what is the biggest barrier stopping people from getting cancer care? Biggest barrier?
Yeah. Oh my goodness. I want to say financial is one of the critical issues that we face. People do not have the money to afford cancer diagnosis or screening, let alone treatment. Cancer treatment is very cumbersome. It's very cumbersome. People have lost their homes, gone broke from trying to stay alive from cancer. We encountered a lady in Cameroon, for example, who was going through cancer diagnosis. She had to do, all the biopsies and all the scans. She told me her family had rallied, sold property to put the money together so that she could get her diagnosis. And then she was just now sitting with the diagnosis because she had no money for the treatment. When we saw her, she had been 1 year into that waiting period, just waiting, knowing that she has cancer, but not being able to do anything about it. And you could feel, you can actually see the lump. It was that big. You could see it. But she's like, what do I do? We have no other resource. So financial, and this is where, again, I keep saying that governments can do better. They can provide these services. They can support the citizens. They can support the population. And I know it's not cheap. I know it's not peanuts, but with government assistance, I believe that we can see better outcomes, better results with cancer treatment. One of the other things that we find is ignorance of the disease. People don't understand what it is. They still, they feel that if I'm 21, I cannot get cancer. But testicular cancer, for example, is mostly prevalent in young men around the age of 21, from the age of like 17 to 25. That's one of the most prevalent cancers in that age group. So the ignorance of the disease, what it presents with, the symptoms, what to look for, what the treatment is, understanding that it doesn't necessarily have to be a death sentence. If it's caught early, it can be treated, with the right treatment and right resources. People do survive and can survive. So that ignorance and fear, lack of awareness is something else. And then the stigma attached to it. Once you're diagnosed with cancer, people start counting down the days. Yeah. It's like you have a death sentence marked on your forehead. People don't even give you the benefit of the doubt. They start to treat you differently, and even the patient themselves start to lose hope. And that's one of the things that I fought a lot with my mom and my family members, is that lack of hope. I never wanted my mom to lose hope. Until the last minute, I wanted her to always have hope. There's nothing more painful than to look into somebody's eyes and you see that blank, like no emotion, just a lack of hope. Honestly, that really breaks my heart. And we see that a lot in the field. We witness that too often. It's really heartbreaking. So the lack of hope, the fear, the stigma, lack of awareness, and then the challenges. In this country, people are aware of what cancer is. Most people are. The challenge they have is working through the system, navigating the resources, where to go for what. And we provide that assistance as well. We try to fill the gap, not only within the DMV. We have had to do that for people who have contacted us from other states as well. How to go about applying for insurance, for example. What type of insurance do they qualify for? Do they qualify for Medicaid or not? If they do not have insurance, how do they afford their medication in a country like this? There are some drug manufacturers that provide.
Sturgeon, there's some people asking question, and I don't want to pass. Grace Noye says, can breast lumps graduate to be breast cancer? And also Mercy is asking, can you talk about benign lumps?
About what? Oh, benign lumps. Benign lumps. Benign lumps.
Benign lumps, yes.
I think
don't want it to pass and then they'll not be able to ask. That's why
I'm sorry. Saying. And then, I don't know how to keep my eye on the comments, unfortunately.
It's okay, I'm here for you.
Yeah. So benign lumps are lumps that are not cancerous. If there are two types of lumps, right? When you feel a lump, it could either be benign, which is just a cyst or, a lump. It just gets taken out and it's fine. or it could be malignant. Malignant is the word that we all don't want to hear because malignant means cancerous. Now, I am not aware that a benign lump can necessarily translate into being a cancerous lump. So, for example, if I have a cyst, that cyst in my breast, I don't believe can over time convert into being cancer. Now, again, I'm not a medical physician, so you might want to check with your doctor, especially if you're having symptoms like that. But with certain cancers, for example, colorectal cancer, it starts out as a polyp, which is a growth. And that growth can either be benign or malignant, or precancerous or malignant. And if it's precancerous, then obviously it's on the journey to becoming cancer. If it's malignant, all that is required is to remove the polyps and it's fine. So I'm not too aware of an instance where a benign lump has converted to cancer. No, I think cancer starts out by cells multiplying, basically, multiplying rapidly. You know, something goes wrong and the cells in that part of the body starts over multiplying and forming this lump. In that process, there's also already, I believe, the cancerous nature involved in that process. And so those cells that start out that way will continue to be precancerous and then cancerous. So I'm not aware that a benign cyst, for example, can convert eventually to cancer. But then again, please check with your physicians, especially if you're experiencing symptoms. If you have a lump somewhere, it's good to have it checked out with your physician.
Yeah, it's good to have a checkup. Very, very important. Until you feel like you are not satisfied, you go to the next and the next. That's what we were talking about.
Yes.
Because there can be an oversight and you end up suffering, and probably something could be done.
Yes.
So don't rely on one person.
I have a friend who is a physician, and she always says, if you were not born with it, get rid of it. You know, if you were not brought into the world with this lump, it does not belong in your body. Get rid of it. Benign or malignant, you don't care. Just get rid of it.
Thank you so much, Sir Joy, for sharing this information. Oh my God, it's too emotional. Personally, I've not experienced somebody close with cancer, but when I hear you talking and other people contributing, I get the feeling. Thank you so much, everybody. Make sure you're liking the live stream, commenting and sharing with more and more people. I'm here with Stella Star Joy. She's an advocate for cancer. She's helping people screen the cancer and survive cancer because the mother and some of the family members were able to go through the same experience. So a mother did the foundation, but they picked up through because they saw how the mother suffered through cancer. So guys, if you have any question, feel free to ask. Today I'm just allowing that because we started off a little bit late. We normally do everything, then people answer, but now if we do that right now, we might miss a lot of people. A lump can be determined definitely as a with histology. All right, thank you so much for sharing.
Please, I would also like to add that if you have maybe you have access and you can, always go have yourself checked out. Let it be like a routine. We do not have to wait till there's something wrong before you can go check out yourself. There's something, some people will say, why would I go to have a doctor's checkout? I'm not sick. But there's something we call, your wellness check, those annual checks. If you can and you have the ability to, please do it. Always go check. And I don't know the age that it starts. For me, I started early to also go for mammograms. But I don't know if there's a certain age they put it at. But for me, I know I started even before I turned 40, I started going to have my mammogram check, have mammogram. So I'm just putting this out there to, encourage us. If you have the access to do it, if finance is not a problem, just always go do your checkouts. It helps. And thank you, Sir Joy. Thank you so much.
Thank you so much. I can see the Sonia over
Yeah,
there.
Morning,
we
everybody.
definitely encourage, I'm sorry, Mazi. We definitely encourage screening, regular screening based on the guidelines. And recently, with the news about colorectal cancer being so prevalent among younger people, we're starting to have a conversation amongst ourselves and the foundation, and hoping that we can make it a wider conversation about lowering the screening age, because 40 or 45 is already too late for some people, because now we're realizing that people are dying at the age of 50 from colorectal cancer. We have people at the age of 20, 21, that are contracting the disease. So how about lowering the age? So screening definitely is one way that we can prevent cancer. Most definitely. It's one of the most important tools in cancer prevention. We encourage it. Please do it. Discuss with your physician about what you qualify for based on your age and your history, your family history. Please make use of the opportunity if it's available to you. For example, my sister who lives in Cameroon, she's never had a colonoscopy, and she's over the age of 50. And lately I've been telling her, you better do it. She says, oh, well, the insurance, blah, blah. I said, well, pay for it. I mean, if you can afford it, pay for it. It really is one of the most important things you can do for yourself is screen. We encourage people for your birthday, give yourself the gift of cancer screening. Or, or for Valentine's Day, I say Valentine's Day is a day of self-love. Love yourself enough to go and get screened. Take those decisions that will impact your life over the course of whatever. And with colorectal cancer, it's so easy. You screen one time. If everything is fine, you don't have to come back for another 10 years. If something is found, then 5 years is when your next appointment is scheduled for. The same with cervical cancer. It's preventable with screening. Please do not put it off, ladies. Breast cancer, prostate cancer. Let's not put those off. Get your screenings in whenever the opportunity arises and you qualify.
Thank you so much, Stajo. Thank you. Somebody wanted to talk. Is it Manzi or Onyeka?
Yes, Mazi. I'm sorry, I interrupted you.
Star Joy, I've been listening in. It's early where I am. I've slept late, but I woke up early to listen in, and what you're doing, it's fantastic. Your organization is doing a lot, and first of all, I want to sympathize with you for the loss of your mom, and Amy as well. I think Dr. Mwende is gone ahead of speaking about her loss as well. A lot of persons have lost loved ones to this very, very serious disease. And I personally, I don't have an immediate family member, thankfully, who've passed away from cancer, but my dad has been dealing with cancer for over 25 years. He's a survivor. He's in his 90s now, but he's been dealing with cancer. He had first had prostate cancer. He went through surgery, radiation, and then later he came here to the US and got chemotherapy because the cancer resurfaced after a few years. After that, he had colorectal cancer. He went through surgery and radiation, and he survived that as well. So he's a survivor. So I would say I have it in my family. He survived it, thankfully. I have an uncle, however, who's much more younger, lived most of his life here in the US, and he had prostate cancer, and he survived that. And a few years after, he had brain cancer, which was totally unrelated. This was not a case of metastasis. It was totally unrelated. And unfortunately, he did not survive the brain cancer. And this was just a couple of years ago in Texas. So having said, I know a lot of people are dealing with this, and the C word, it's a very fearful one. When we hear about it, we're very scared, and for good reasons, because it's one of the complex disease that medical science is still dealing with. There have been billions of dollars invested in the treatment, and research on this disease. I was reading a journal last year. Cancer treatment. The government budgeted about $7.3, I believe, billion dollars. Billion with a B. On the research for cure and treatment. However, we still don't have a cure. And every year, the budget for cancer keep increasing. So I know that what you're doing is very, very capital intensive, because none of these screening tests is cheap. And you're dealing mostly with people in Africa, where they don't have good safety nets to help people who are uninsured. And in most cases, there is no insurance scheme, to help these people navigate the process of screening and diagnosis and eventually treatment. So I wonder how you're able to fund this. That's one thing I've been thinking about, at the back of my mind, because I know this is very, very expensive. Here in the US, for example, for those who have insurance, they can get, screening, they can get treatment. If you don't have insurance, though, there are structures that have been put in place that could help. You just have to tap into it. A lot of people don't know about it. You just have to tap into it and assess those structures that have been put in place. For example, the hospital system do have programs for uninsured, and you have to meet certain criteria. You have to meet some income criteria, and we know that treatment can go in the hundreds and hundreds of thousands of dollars, and most people don't qualify because of their income bracket, right? And there are other programs as well. The hospitals have an arrangement with the IRS where they have to pay in some money into charity in form of treatment. They call it the hospital charity care. If you work in a hospital, to start, Joy, I'm sure you're probably aware of this, where hospitals have to provide some charity care to certain patients. And again, not every patient qualifies for that. If you may be fortunate and lucky, if you're here in the US, you may qualify for that. And there's also pharmaceutical assistance program, the PAPS program. You're probably aware of that as a pharmacist. And that only cover about $10,000 a month. And some cancer medications can be one drug can be over $10,000, and some of them are multiple drugs. So that can cover some part of your treatment program. And then if you are lucky enough to be chosen into clinical trials in some form of cancer, then you could get free treatment. If you're choosing, if this is a kind of cancer that is being researched with some new medications, and you're lucky enough to be choosing about. I got the call that came in, so it kind of cut it off a little bit. But if you're lucky enough to be chosen by your oncologist, and you fall into certain criteria, you meet some criteria, your oncologist or your social worker can sign you up for those programs, and you may be able to get care. I used to work in oncology, and I've seen patients that are uninsured, get free treatment. My experience in oncology was such that a lot of patients get treated. After a few years, the cancer resurfaced, and we had a lot of deaths. I actually left oncology because of that. I felt that cancer, it's almost a death sentence, even here in the US. Even here in the US. However, like you have rightly emphasized here today, I'm happy you did emphasize that a lot. Early treatment is paramount. I mean, early detection is paramount. Now, Amy also emphasized that. Go for regular screening. If you are predisposed, if you have a parent or a family member that has been diagnosed and treated with any of these cancers we've talked about today, please have your PCP, your primary care practitioner, your GP, wherever you're located, put you through regular screening as required. Because if these are detected early, you have a better chance of getting treated, and your prognosis is a lot better than someone who's detected at a very late stage of the cancer. And like you were saying, there are some cancers now. The guidelines, for example, mammograms, 40 to 45 years, you are required to start doing yearly mammogram, right? But nowadays we're finding patients in their 20s having breast cancer. So these guidelines are put in place based on, the general statistics that they have. However, there's a good percentage of patients who don't fall into those categories. So you can start doing your breast exam on your own as you take a shower. That's just an example. You talked about young men, being diagnosed nowadays of testicular cancer. You can start checking yourself. You find a lump, don't think that's just a lump. It's okay. You can start screening on your own. And if you find something, bring it up to your healthcare provider, because early detection is key with cancer. If your cancer is detected at a very early stage, you have a better chance of responding to treatment, possibly surviving it. And again, I want to thank you all for sharing your experiences. It's been very, very, very insightful and informative. And I think I've learned a lot from this live stream today. Coach, thank you for bringing this to the limelight. This is very important. I will definitely key into what you're doing, because I know how important it is. Anyone out there who thinks that, it's not, it's never going to happen to me, just wait. Just be careful. Just do what you're supposed to do. Nowadays, we don't have much of people engaged in excesses like alcohol or alcoholism and smoking and things like that will predispose you to certain kind of cancer. You can live a perfect life and you will still be diagnosed with cancer, because a lot of the food that we consume nowadays it's genetically modified. There's a whole lot of factors that can predispose you to cancer, a whole lot of factors. So you may think you're doing everything right. You may think you're doing everything right, but you want to make sure you're going to your doctor, you're getting screened for whatever cancer you think you may be predisposed for. I don't know if you heard of this. There's some new screening. They call it liquid biopsy. It's a new screening that is out there now, where they can take your blood and screen for multiple kinds of cancer. A lot of insurances don't cover it. I like what you said about giving yourself a gift This is a few hundreds of dollars, this screening. I haven't done it myself, so I hopefully I'll be able to do it in the nearest future. I think this discussion has motivated me to start thinking about that. As we were talking, I remember that I'm like, you know what? Maybe I need to pay for a liquid biopsy. It's called the MCED, MCED, multiple cancer early detection. It's a blood test. You can ask your PCP about it. The first thing they're going to tell you, why do you want to do it? No, you have to advocate for yourself.
That's
Just
right.
tell them, listen, you don't have to run it through the insurance. If you think they're not going to pay for it, just give me the order. Let me go get it done. You take that order to Quest or any lab, and they'll take your blood and get you screened if you can afford it. That's an investment you can do for yourself. That liquid biopsy will detect multiple kinds of cancer that is in your blood. Because years and years before cancer shows up in your body, the cells have been growing. It takes years for the cells to grow. However, there are certain kinds of cancer that rapidly grows, but most cancers take years to grow. So I don't want to talk too much about this, but I'm really full of gratitude and appreciation for what you do, and I admire what you do. And Coach, thank you for bringing this to the limelight. And I'm sure one or two persons here, like I do, have greatly benefited from the information that you have provided here today. But again, I encourage everyone who can, whether it's by way of volunteering or by financial support, to key into what StarJoy does, because what you're doing, government and nations and big organizations are trying to do this, and I know it's capital intensive. It's not cheap. Nothing about cancer is cheap. Whether it's the screening, whether it's the awareness, whatever it is, it's not cheap. And then again, you have to deal with conspiracy theories out there. People who believe that, all of this is a way for the pharmaceutical to kill us. There are people who don't believe in treatment. They don't believe in chemotherapy. And I don't blame them, because they see patients go through chemo and they don't survive, they die.
They don't survive.
Yeah. So they think that, okay, there's this plot for these people to kill us, And then there's others that believe that there has to be a cure, but they don't want to provide a cure because it's a very lucrative business. So there's a whole lot you have to deal with trying to educate people. So you are doing great work, my sister. Thank you so much. Thank you.
Thank you so much. I'm glad you talked about self-exams. We talked about screening being an important tool. Self-exams are one of the ways that we empower ourselves to take ownership of our bodies. And you know why we ask people to do self-exams? We're not advocating for people to be able to find cancer by themselves. The self-exams are not meant to be a diagnostic tool. We ask you to perform a breast self-exam or a testicular self-exam or a self-exam of your thyroid gland, which is in your neck. It's very easy to test for. We ask people to do that just so that you are familiar with your body, so that if something were to change, you will be able to detect that something has changed before even a physician, because most of us go to the doctor once a year for a physical, and that's when they touch here and do all of that. But in between that time, something can come up. Being aware of what your body looks and feels like allows you then to be able to catch changes before even your next doctor's appointment. We tell women, for example, you should know your breasts so well that if everybody's breast was cut off and put on the table and you were blindfolded, you should be able to walk up and just feel and say, this is mine and that's mine. That's how well we want you to be in tune with your body. And that's why we ask people to do self-exams. There are many booklets and guidelines and YouTube videos about how to perform these exams. If you ever need help, you can reach out to me. I can provide what I know and direct you to resources. But it's very, very important to do that. The second thing that Mazi touched about was this liquid diagnostic test. It's about it's introduced by the same people that produce what we call, and I don't know if I should say it. Anyway, there's a test for colorectal cancer where you're supposed to take a stool sample and, blood on a specimen card and send that off to a lab. You do it yourself at home. Basically, it's a self-test at home. The manufacturers of that test, the people of that test, are the ones that have come up with this liquid biopsy, because cancer cells produce markers, what are called markers. They produce certain chemicals that are in your bloodstream. And this test is supposed to pick up those markers even before you start to feel the symptoms of the cancer, way ahead, sometimes years ahead. And so that's one tool that physicians can use. And I'm hoping that physicians will welcome it as an aid to manage their patients' health, overall health. And even for patients who have cancer throughout the journey, they're tested for certain markers, like breast cancer, you might do a CEA and other things. But with this test, you can test and catch those markers in the bloodstream before the patients even start to see symptoms of the disease. As far as funding, it is really one of the biggest challenges we have. It's huge. We are so lucky that for all of these years, we have been supported by mostly our community. We rely on community donations. We are mostly self-funded, but we do get support from the community. We used to host these lavish galas once a year that were like the talk of the town. Everybody would come and we would raise funds that way. Since COVID, we haven't done that. But we do online fundraising drives, and it's becoming more and more challenging because people are tired of giving. And not only because they're tired, but they have fewer resources as well. Their dollars have to stretch even further. And so over the course of years, we have had to pull from the same limited source. And now that source is really slowly drying up. And so now we're thinking about other ways to do this, to mobilize resources so that we can continue to do the work we do. My sisters and I basically fund most of what we can. And we have a strong board, with membership that really believes in this cause, and they buy into it and they support us in every which way possible. We are grateful for that. We have volunteers who give their time and their expertise. If we had to pay every volunteer who comes or every doctor, we would not be able to do it. And we're grateful for the volunteers. We have partners who work with us to provide some of the medical interventions. And like the surgeries, for example, I'm not a surgeon, but we have a whole surgical team, 2 surgical teams even, that accompany us, and they do this all for free. And, we have teams that come in to screen for, we have a cardiac team that comes in from a cardiac hospital. We have a dental team. We have mental health because, with the crisis in Cameroon and with some of this cancer, people are going through a lot, and it weighs heavy mentally. So we have a mental health department with a team from the doctors, the Cameroonian doctors in the UK. They provide that service for us. We have a whole team that we work with to help to really to mitigate some of the expenses, to provide the expertise, but also to be our foot soldiers on the ground, because at the end of the campaigns, they're the ones who take charge of the patients that need follow-up after, and they are trusted names in the country. When they come to town, people recognize who they are. Last year, for example, we were trying to go to a village, and the elite of that village that we were seeking support from kind of just, did not care for the campaign, because they one of the statements that they made was that we could be charlatans. It's like, how do we know that these people are who they say they are? They could just be quacks, coming to town. And that's fair because they do not know us. They don't know Pacha Foundation. But when we come to town with some of those big names that they know, they sit up and they are more receptive to the support we're trying to provide, the services we're trying to provide. Because truly, you can bring all the expertise in the world and people still don't show up because they don't trust the source. So we're trying now again to be kind of innovative in how we fund the foundation's activities. We're looking into going into farming. Mazi, that's why I said that I'm interested in your program coming up, because we're trying to look into maybe starting a farm to eventually be able to use the resources from the farm to provide funding for the foundation. We're looking at all kinds of things, a car wash, because just picking dollars here and there from the community is good, but it's not sustainable. It has brought us along for 10 plus years, but we don't see it continuing for the next 10, even the next 5. We need to innovate. Unfortunately, we have not been able to get any major grants for cancer. I mentioned before that we've been in many rooms where funding is involved, funding is discussed, many conferences, international, locally, and over and over again, we get a few things said to us. Number one, HIV kind of sucks up all the oxygen in the room. If it's not HIV, it's difficult. The second used to be the Ebola crisis. Cameroon did not qualify for that, so we didn't get any of those, those types of funds. Stability, we're not a very stable country right now, obviously, and so people are kind of like, we don't know if we want to involve ourselves in a situation where a couple of years down the line, it might all go up in smoke, So we still strive to hopefully someday be able to get major funding, major support from the big names, those names that when they write a check, you just know that everything is going to be all right for a few years. That hasn't happened. We continue to try. But in the meantime, we rely on our community. We rely on ourselves. We tax ourselves first, and then we rely on our community. And then we hopefully will implement some of these, non-conventional, innovative ideas that we're looking at in order to be able to be sustainable.
Thank you so much, Star Joy. Guys, you have heard what she has said. If you are able to support this unprofitable organization because they have to chip in at all times, you can do so. Which other platform are you in, Star Joy, apart from TikTok?
Okay, I'm allowed to say?
Yes.
Okay, so I'm on Facebook. But the Pacha Foundation is on Facebook and Instagram. Have been for years. We have a very strong presence on Facebook and Instagram, and it's spelled Pacha, Patcha Foundation. I'm also on Facebook and Instagram. On Facebook, under Stella Maris Pacha. That's Stella with a hyphen, Stella-Maris Pacha. On Instagram, I'm Miss Stella Maris. I'm also on YouTube, but there's nothing to talk about there. The only follower there is me. So, and of course, LinkedIn. We're on LinkedIn as well.
All right. Thank you so much. We have not even covered half of what we were supposed to. So definitely I have to invite you again. Guys, if you have any questions, I don't know if we can handle more than one question. We started handling questions earlier because of the situation. So we can only allow only one question or one contribution so that you're able to end up this live stream. Anybody with a burning question or contribution? All right, Ben, you can open your mic and speak.
Yeah, I have a comment and question. Hope I'm allowed. Greetings, Coach.
Hello, Dr. Somi.
And our guest. Can you hear me?
Yes, we can hear you. We can hear you. Ben, sorry for that. Let's take Dr. Somi.
I'm audible.
Yes, we can hear you.
Yeah, me. Yes. Thank you. I'm a family physician. currently practicing in Nigeria. And I was just passing by and I couldn't leave because this one very vital discussion I met ongoing, and I've been listening and watching. Thank you so much for all the information, the discussion around this, surviving cancer. The burden is so much. But my question is, I have heard about Cameroon and then the support people are receiving. What is the extent of your reach? I know the financial aspect is for huge consideration, the support, very important. But do you have limits to where you want to reach or where you are reaching in terms of where you are giving support? I hope you
No,
got.
I'm sorry. Go ahead.
Okay, so that's the question. But my comment is more about the psychological effect that patients get or individuals get to have, even the thoughts and the evaluation screening for cancer itself, especially with the burden, the financial burden, the fear of death, and all that comes along with it. So I want to just mention that it's always good that we keep increasing our advocacy and support for people who are already diagnosed or people who are being evaluated for cancer, and then the need to just be there. Sometimes some people already have the diagnosis, but they just need that support. Some, it's not even something that has to do with finances. It may just be that being present. So family members have so much that they can do. Friends, religious groups, society. This is not a time to abandon your loved ones. It's not a time to leave your friends. A friend in need is actually a friend indeed. Thank you.
Thank you, Dr. Sonyemi, for your contribution. Stajoy, did you want to respond on something? Yes.
Yes, I do. And before he goes, I wanted to ask him the question that somebody asked about benign lumps becoming cancerous lumps. I posted in the chat. I'm not sure if he saw it and if he can provide an answer.
She's up here. Mercy, are you in the position to speak?
Yeah. I think you answered it very, very correctly.
Yeah.
The
Okay.
short answer is no.
Yeah.
Again, key emphasis. Short answer is no. Benign cancer typically do not turn into benign lumps. They typically do not turn into cancer. However, you talked about polyps. You could have benign polyps, and one thing I wanted to correct it is every 5 years. That is the gold standard in the United States. If you are predisposed, if you have a family member who is who's been diagnosed with colorectal cancer, you have to do your colonoscopy screening every 5 years. But if you are healthy, you've never had any family member who've had it, so in the medical community, you are regarded as not predisposed. You don't have any familiar reason why you'll be screened more frequently. And in some cases, you could be screened depending on the result of the biopsy. You could be screened yearly for colorectal cancer. But however, any benign tumor you have in any part of your body is benign because it's not cancer yet. A lot of those benign tumors cannot eventually progress to be cancerous tumor. But that is relative. So you have to defer to your oncologist for that. Go to your doctor. Whatever information we're providing here is for informational purposes only. Do not say, well, I had a benign tumor 2 years ago and I'm being told today that it's never going to become cancerous. Cancer, like we know, they are cells, they are abnormal cells that can grow, and it may or may not. It just means that it's benign at that moment, at the time it was tested. it's benign. No cancerous cells were found. You want to continue to be screened to be sure that it does not grow into cancerous cells. I don't know if that answers your question.
Yes, thank you. Yes. Thank you so much.
Thank you, Mercy, for answering the question, and thank you for responding. Last person, Ben.
Well, doctor's question that he asked about our reach. I think one of the questions you asked about was
Yes.
about our reach.
Rich.
I don't know if you're referring to our reach within Cameroon or globally. I'm not sure, but we have no limits. As far as the people who reach out to us, we have
He's
absolutely no.
responding.
Oh, I'm sorry.
Doctor, you can go on.
Yes, I was asking about the global reach. Is your reach outside, I mean, beyond Cameroon, or your focus is on Cameroon?
No, we have no limits. It's all a matter of funding and accessibility. Like I said before, we've been to Sierra Leone on invitation. Our director in Cameroon, her title is not Cameroon director. Her title is Africa director, based in Cameroon. And so very recently, we had an invitation to go to Equatorial Guinea, which unfortunately, halfway through the planning, we were not able to continue. But no, the short answer is we have no limits. And even right here in the DMV where we are, we receive calls from all over the United States from people who need our assistance. And we provide the support that we can. We turn no one away. I don't know
Did that answer your question,
sufficient?
Dr. Sonyemi? Did it answer your question?
Yes. Yes, sure, it did. Thank you so much, ma.
I feel like, was there a second part to your
Thank you,
question?
Star Joy. Thank you.
Doctor, was there a second part to your question? Did you have another question? If not, then we're good.
No,
I think Ben has a question. You can share the question.
Okay.
Yeah. Ben, please be brief. Thank you.
Okay.
Okay, thank you, everyone. It's not really a question, but I just want to appreciate our hosts and our invited guest, Star Joy. Thank you so much. This is my first time of seeing you face to face. I really appreciate your presence here, coming to educate us on how to, take care of our health. Talking about because basically this platform, we talk about purpose a lot, finding purpose on what you are doing, and from every indication I am seeing a lot of sacrifice, a lot of energy, putting in to just see the overall well-being of a human family is not an easy thing. People bringing out even the time you are spending with us. Everything this time is money. Time is money. So we so much appreciate the time you are bringing out to share this knowledge, just across to anyone that are victim of cancer. Information is very, very vital. We cannot downplay that. I so much appreciate, and the Lord will keep supporting you. Every stream of income that you need to see this reality, standing in that gap, God will surely meet you at the point of that very need. And the best way we can do, we can also see how we can rally around you to see that every purpose you have desired in this very aspect that is coming to reality. So thank you very much. And lastly, I talked about the aspect of maybe individual thing, like what you are doing right now, a source of income where things can, money can come in place to see that, this thing is moving forward. Mostly information is very, very vital. Like our people used to say that prevention is better than cure. Sometimes once you have a platform where people can be educated, like knowing the things that they need to know from the beginning, because I believe that before anything start happening, there is a root cause of everything that happens to us health-wise. So I believe that giving out this early information to young girls, people that are getting married, and people who are out there, first-hand information is very, very important. That will really help people to abstain from some certain things that will really be a pointer to having this kind of sickness over time, because it's not just something that will just grow up overnight. It has been an accumulated wrong way of living that have resulted to cancer and all that. So thank you very much for coming around. God bless you.
Thank you.
Thank you so much. I appreciate all of you. Because of time, we're gonna end.